Do you know there's a very tiny pill, probably sitting right now in your home, that has the power to either save your life, or put it in serious danger? That pill is aspirin. For some people, aspirin is nothing less than a miracle drug. Doctors prescribe it every single day to prevent heart attacks and strokes. But at the same time, experts and researchers also warn us that this same tablet can increase the risk of life-threatening bleeding. This creates confusion. Many people start taking aspirin on their own, thinking it will keep their heart safe. Some even take it daily without knowing whether they need it or not. On the other side, some people are so scared of its side effects that they avoid it completely, even when a doctor has prescribed it. So the real question is, what is the truth about aspirin? Is it a lifesaver or a silent killer? Is it your heart's best friend or your stomach's worst enemy? In this video, we are going to explore everything about aspirin, its uses, its benefits, its risks, and most importantly, who should and who should not take it. Aspirin is one of the most popular and widely used medicines in the entire world. It's not a new drug. In fact, it has been around for more than a century. The active ingredient in aspirin is called acetylsalicylic acid, and it was first developed in the late 1800s. Since then, it has become one of the most trusted and most prescribed medicines in history. Most people know aspirin as a simple painkiller, a tablet you take for headaches, fever, or body pain. And yes, that's true. But aspirin has another very important function that makes it unique. It also works as a blood thinner. This means that it prevents your blood cells from clumping together and forming clots. Blood clots are one of the main causes of heart attacks and strokes. By reducing the risk of clot formation, aspirin can literally save lives. That's why doctors often recommend low-dose aspirin, usually 75 to 150 milligrams daily, for patients who have a history of heart problems. This tiny tablet may look simple, but the impact it can have on your body and your health is incredibly powerful. Aspirin's benefits are impressive and wide-ranging, which is why it is still so commonly used even after more than 100 years. The first and most common benefit is pain relief. Aspirin is very effective at treating mild to moderate pain, whether it's a headache, toothache, muscle pain, or joint pain. For many people, it provides quick and reliable relief. Secondly, aspirin reduces fever. Whenever the body is fighting an infection, fever is a natural response, and aspirin can help bring it down, making the patient feel more comfortable. Third, aspirin is an anti-inflammatory medicine. This means it reduces swelling and inflammation in the body. That's why it has been used for years to treat conditions like arthritis, joint pain, and even certain sports injuries. But the most important benefit, and the reason it is so famous, is its role in protecting the heart. Low-dose aspirin can prevent blood clots, which in turn reduces the chances of heart attack and stroke. For people who already have heart disease, this small pill can be life-saving. That's why many doctors call aspirin a miracle drug for cardiovascular health. Now let's talk about the other side of aspirin, the side effects and risks. And this part is very important because many people only hear about the benefits but don't realize the dangers. The biggest risk with aspirin is its effect on the stomach. Because of the way aspirin works, it can irritate the stomach lining and lead to problems like gastritis, ulcers, or even internal bleeding. People who already suffer from acidity or stomach issues are at much higher risk of these complications. The second major risk is bleeding. Since aspirin thins the blood, it makes bleeding harder to stop. This might not sound serious, but it can become dangerous if someone gets injured, has surgery, or develops internal bleeding. In rare cases, it can even cause bleeding in the brain, which can be life-threatening. There's also a very specific warning. Aspirin should never be given to children under the age of 12, because it can cause a rare but deadly condition called Reye syndrome. So while aspirin has amazing benefits, it is not a completely safe medicine for everyone. It must be used carefully and under medical supervision. This brings us to an important question. Who should actually take aspirin, and who should avoid it? Aspirin is very useful for people who already have heart disease or are at high risk of developing it. For example, if someone has had a heart attack, a stroke, bypass surgery, or stent placement, their doctor may prescribe daily low-dose aspirin. In these cases, the benefits clearly outweigh the risks, and aspirin can prevent further heart attacks or strokes. On the other hand, healthy people who do not have heart disease should not start taking aspirin daily on their own. Studies have shown that for people without a high risk of heart disease, the risk of bleeding is often greater than the benefit. It's also important to remember that every patient is different. Your age, your medical history, and the other medicines you take all matter. That's why doctors make decisions about aspirin on a case-by-case basis. So the rule is simple: only take daily aspirin if your doctor recommends it. Do not start it by yourself just because you've heard it's good for the heart. What is life-saving for one person can be dangerous for another. In the end, aspirin is truly a double-edged sword. On one side, it has saved millions of lives by preventing deadly heart attacks and strokes. On the other side, it has also caused serious harm when taken without proper medical advice. That's why it's so important to understand this medicine clearly. The biggest lesson here is, aspirin is not a vitamin. It's not something you take casually every day because you think it's healthy. It's a powerful drug with powerful effects, both good and bad. If you are the right patient, it can protect your heart and extend your life. But if you take it unnecessarily, it can damage your stomach, increase your risk of bleeding, and sometimes create more problems than it solves. Always remember, your health is unique. Your age, your medical history, and even your lifestyle make a difference in whether aspirin is safe for you. That's why you should never start or stop aspirin on your own. Always ask your doctor before making a decision. Now I want to hear from you. Do you think aspirin saves more lives, or causes more harm when used incorrectly? Share your thoughts in the comments. Your experience might guide someone else to make a safer choice. And if this video helped you, don't forget to like, share, and subscribe for more clear, simple breakdowns of the medicines we use every day.